putting in a testosterone pellet, an estrogen pellet, and the collagen pellet is what we use to prevent scarring or to reduce the scarring after we make our tiny incision. Okay, so what we have on our tray, we have our Tropar set, we have our spray, we have our lidocaine and our bicarb, and we have needles, we have our tegaderm, and then we have sterile gloves and a drape. So what I normally do, I start by putting on my glove, and then my faithful medical assistant here will assist me in getting everything else to me. Okay, so first thing, I get sterile. And the landmarks, we use the gluteal fold, and then we come up to the side. We don't want to be on this side, we don't want to be flat. We want to put it on the lateral side, so it's like kitty corner. This is the side where we insert the pellets. If it's this way, it's going to hit when she turns corners. If it's on the bottom, then when she sits on it, it's going to hurt. So we want to put it on this section here. So, if you want to know how to put on a glove where you're not contaminating it, you open it up and you put your fingers in, and now that you're nicely sterile, everything has to be passed to you. What I like to do first is to clean the area, so let's start with the betadine. So we clean that area that I mentioned, the flat part. One time on one side, second time. Then we use alcohol to remove the betadine and to sterilize the skin even more. And then we put our drape. The drape has sticky on it. We take the sticky off and we find the area that we're going to put in the pellets in, just like that, right there. And now I have created a sterile field. I'm going to ask you to move a little bit closer to the window, which you touch. There we go, a little bit more. All right, perfect. So now we have some table space to work as well. Let me have the tray. So now we have the tray. You can put that tray on top of the paper. Now the syringe. We are going to anesthetize a small area with lidocaine, 7 parts lidocaine to 3 parts sodium bicarb. Lidocaine. So I take 7 cc's of lidocaine.
Sodium bicarbonate.
Take the needle off. And we use about a 1.5 inch needle is all we need. And the gauge is 27 or 22.
22.
22, okay.
Right.
So now, after I get that, I get my gauze, and then I kind of just pinpoint a spot within my circle where we're going to anesthetize. So I'm just going to put it there, put a little bit of pressure. It makes a little indentation, and then you ask your assistant to spray. 3 shots.
Cold spray.
Not too close. 1, 2. You can come closer with the camera.
Oh, I'm zoomed, Dr.
There you
Christie.
go. Okay. All right, so then we have that white spot. Let's do 1 more shot.
Cold spray.
1 touch. And I wait until it whites up. That's when I know it's at the maximum point. Start just a 1/2 of an inch in, and I indent and I put it normally burns a little bit. The patients, I tell them, you're going to feel a little burning sensation, stick and a burn. And I put at least half of it right at my point of entry. And then I rotate it up to go upwards. As I advance it, I put a little bit more each time I advance. So I'm anesthetizing the subcutaneous area. It's not in the muscle. This is in the fat. Notice the position of my needle. Yeah. And with men pellets, we normally anesthetize here, then we go here, then we go here. With women, we just anesthetize one spot straight up because they only need two to three pellets, whereas a man needs anywhere between. I'll just. They need anywhere between 6 and 12 pellets.
Is that because men have more muscle?
Yeah, men need more testosterone. Men typically need between 1,400 milligrams to 2,000 milligrams. Women will typically give them 100, maximum maybe 125. So it's a very much smaller amount women need. And then we wait. We have to decide how much pellets the patient has to receive. She's been getting pellets pretty much consistently every 3 to 6 months. This happens to be a 6-month break. But we have our symptom sheet and we look at that and we say, okay, well now her estrogen symptoms are 10, her testosterone symptoms are 7, progesterone is 5, and her cortisol is 4. So cortisol is doing the best. The estrogen, she's having some dryness and thinning, memory lapse. So she needs some estrogen, but she also has some estrogen excess symptoms like the mood swings and the tender breast. So we're not going to change her dose because most of her estrogen symptoms seems to be more on the estrogen dominant side. So we don't increase the dose if she's having those symptoms. Because with estrogen, it's not just the number, it has to do with that person and how sensitive they are, how much estrogen is stored in the fat. Okay, so essentially we're just going to go with her same dose, which is 100 of testosterone and 12.5 of estrogen. So now you have your medical assistant to put the pellets on. They come individual in capsules, so it's sterile. So he takes off the cap, takes off the rubber cap, and then he puts it in your tray. He does that again. That's the testosterone, right?
Yeah, this is
So the pink is estrogen. I wonder why.
Women like pink.
Yeah. So you put that there, and then we do the collagen pellet, which helps with scarring. All 3 pellets that are in. So the next step is to make your tiny little incision, but I do that after another cold spray. So we go back into that same hole that we made, so we don't create a new hole.
Cold spray, man.
Okay. And I wait until it's dry, and then I just put the bevel up of that, and just a pinch. Okay. Spray again. Sometimes the skin is still a little not anesthetized properly, so I spray a little bit more, and then I just insert. I want to make sure that I get the bevel, at least that tip of the part of the needle in before I do anything. Okay, so once you have that, it's pretty dry, then you get your trocar. The trocar looks like this. It's got a hollow hole in it. And then you have the part that goes in. So it goes in through here, and you have to have the bevel of that flat. So you couldn't do it that way. That's incorrect. You want to make sure it's flat, so when you insert, there's a nice flat tip. And this is the way you advance. You want to hold the tip of the skin, spray again, one more spray, because the skin is sensitive still. There we go. And then I go right back in that hole, put a little bit of pressure down, and it's just a tiny little, just glide it in, rotate it in, pull it out. Then you use your tweezer to put it doesn't matter what order you put the pellets in, but they go right in here. That's one. Oops, and let's put that one in here. The estrogen is so small because it's only 12 milligrams. Put it there, get it right in that spot. And then the last thing should be the collagen pellet. And once all three of them are in, there's a different part. You don't want to use this part. I call this the thumper part because it's flat. You put it back through the hole and you slide it in, hold that, and it's just a push. Pellets are in, you pull out everything all together. And then you dry it. Put a little bit of pressure, make sure there's not significant oozing. A piece of gauze, and I typically fold it. I take off we want to dab that dry. We take our steri strip and we pull the skin together like that. I need a little bit more gauze. Just put the Tegaderm on top.